Cardiovascular and respiratory responses to aerobic and resistance exercise training. The effects of aerobic and resistance exercise training on both the cardiovascular and respiratory system are key to understanding physical or athletic performance and designing training programs. The following section discusses the effects of training on the specific areas of the heart, circulation, ventilation, oxygen extraction, and lactic acid. The heart. Aerobic training results in several changes in cardiovascular function, including increased maximal cardiac output, increased stroke volume, and reduced heart rate at rest and during submaximal exercise. Less is known about the effects of resistance training on the heart, but they appear to be less pronounced than those of aerobic training. Aerobic training. For optimal aerobic exercise performance, increasing maximum oxygen uptake is of paramount importance. One of the primary mechanisms for increasing maximal oxygen uptake is the enhancement of central cardiovascular function, cardiac output. Although the normal discharge rate of the SA node ranges from 60 to 80 times per minute, exercise training may result in a significantly lower discharge rate. It appears that physical training creates an imbalance between the activity of the sympathetic and parasympathetic systems in favor of parasympathetic dominance. Increased stroke volume also affects the resting heart rate. That is, as more blood is pumped per contraction, the heart tends to contract less frequently. Aerobic exercise training can increase the heart's ability to pump per contraction at rest and thus may account for some of the significant bradycardia, slower heart rate, observed in highly conditioned endurance athletes with heart rates commonly ranging from 40 to 60 beats per minute. The most significant change in central cardiovascular function with long-term 6 to 12 months aerobic exercise training is the increase in maximal cardiac output, heart rate times stroke volume, resulting primarily from the improved stroke volume. Additionally, a significantly lower heart rate after aerobic training than before training in response to a standardized submaximal level of work is also a hallmark of aerobic training. Furthermore, the heart rate increases more slowly in trained athletes than in sedentary people for a given workload. Because the maximal heart rate may actually decrease slightly with prolonged training, perhaps as a result of increased parasympathetic tone, the size of the left ventricle, both the chamber volume and wall thickness, and the strength of contractions, increased contractility, are key to increasing the stroke volume with submaximal as well as maximal exercise. Resistance training. The findings regarding the effects of resistance exercise training on the heart are less conclusive. Most controlled studies use echocardiographic findings to describe typical heart sizes and volumes in resistance athletes, although it has often been suggested that resistance training would produce a large heart. This has not generally been substantiated with scientific data. Much work is still needed to clarify the effects of resistance training on the heart, but strength and conditioning professionals should assist athletes in understanding that as far as is known to date, most athletes' hearts do not respond adversely to resistance training and in fact continue to exhibit normal physiological with such activity. It also appears that resistance training is not particularly effective in improving maximal oxygen uptake even when using circuit training methods. Capillary supply. In addition to delivering oxygen, nutrients, and hormones, the capillary circulation provides the means for removing heart, heat, and metabolic byproducts. Enhanced capillarization appears to be associated with volume and intensity of activity. Regardless of whether it results from aerobic or resistance training, increased capillarization has been observed in response to an increased density of muscle associated with aerobic training. This increase in capillary density decreases the diffusion distance for oxygen and metabolic substrates. With resistance training, the response appears to be related to the relative contributions of intensity and volume of exercise. The high intensity and low volume seen in powerlifting is associated with no change or decrease in capillary density, due to the dilution effects of muscle fiber hypertrophy. Conversely, training of low intensity with high volume, such as used by bodybuilders, may actually increase capillarization. Further research is necessary to clarify the impact of exercise training on capillary density and to establish the precise physiological role of these adaptations. Ventilation. Ventilation generally does not limit aerobic or resistance exercise regimens and is either unaffected or only moderately affected by training. Furthermore, the ventilatory adaptations that are observed appear to be highly specific to activities that involve the type of exercise used in training. That is, adaptations observed during lower extremity exercises will primarily occur as a result of lower extremity exercise training. If lower extremity exercise training is performed, one would not likely observe ventilatory adaptations during upper body activities. Training adaptations include increased tidal volume and breathing frequency with maximal exercise. With submaximal activity, however, breathing frequency is often reduced while tidal volume is increased. It appears that such ventilatory adaptations result from local neural or chemical adaptations in a specific muscles trained through exercise. Additionally, improved ventilation efficiency, as characterized by reduced ventilation equivalence for oxygen, the ratio of air ventilated to oxygen used by the tissues, VE over VO2, has been observed in trained versus untrained individuals. Oxygen extraction. As previously described, maximal oxygen uptake is a function of cardiac output and arteriovenous oxygen difference. Arteriovenous oxygen difference reflects the ability of muscle tissue to extract oxygen from blood. Aerobic exercise training increases the number and size of skeletal muscle mitochondria, producing significantly increases the amount of oxygen extracted from the circulation of blood and constantly increases the arteriovenous oxygen difference. Aerobically conditioned individuals have greater ability to extract and use oxygen at the cellular level during maximum aerobic exercise than untrained people. Oxygen extraction is generally not improved with resistance training of heavy resistance and low volume. Some improvement is observed with more moderate workouts and increased volume.